Hi, my name is Holden Leung. I'm the executive officer of this agency, but I started as a mental health clinician when I joined this agency in 1992. Whilst like a lot of immigrants coming to a new country, everyone wants to continue their career, and I have the fortunate to continue my clinical practice as a clinical mental health counselor. And back then, I had the opportunity to meet with my board chair, and it's not difficult to adjust to the work environment because I'm the one of the two counselors. So, with that said, that helped me to understand, hey, clinical practice as a mental health counselor can be the same school of thought, but like when you applied it to different locations, like Portland, Oregon, over 30 years ago, it's a different story. So that is something that keep me here for more than 30 years. Currently, I think I'm the architect, put it that way. I'm the architect for the program developments. I am the compliances person to make sure clinicians are doing. And also, I always say that while standing on the shoulder of the giant of my board chair, his visions, like how we can like realize a few, if not all, and workforce developments, and also how to make sure to sustain the workforce. So my role is more on like advocating for the service model that will feed the Asian populations. My role is more on like how to negotiate culturally and linguistically appropriate services for the constituents. My role is more to like secure funding from the state, from the county, from our health partners to allow funding that is not billable in the Medicaid field, but that is needed for our clients. So that is my role as now more as architect or maybe engineer, but like not on the day-to-day operation. But with my clinical practice over the years, people will find way to reach me. Just like yesterday, I received a text from one of my contacts. I don't want to disclose too much to protect the client's confidentiality. She can be cited as an example. Stable family situation, raise up a child, married to Americans, she's Asians. But when something happens, crisis happens, she texts me saying that my husband passed away a few months ago because of heart attack. And then she want me to like provide needed support, not for herself, but for her children. And so with that, I think that is a good example that while I may not serving as a clinician now, but I may be easy to being recognized that someone trusts me and share. And so that is my role as to connect with my clinical team, reach out to that person's and family and see how we can help. When I started the mental health clinician's role, the mental health program is very significant, very needed. But that was stationed at the basements of a church, and that become double stigma. On one hand, being stigmatized, like that people go to a mental health clinic. And now they're stigmatized is, well, I'm a Buddhist, and I don't want to go to a church for some services. So seeing the stigmatizations and also with Dr. Sito's visions about the need to serve patients, the mental health need. So with that said, we start to look into, well, there may be some services that Medicaid don't pay. What are those? Engagements. Engage people before they become sick or they are willing to admit they are sick. So how to engage those people from cultural celebrations, from English classes, from citizenship classes, to engage them so that they can like come. And then with that said, we try to expand program to cover those, and then eventually add one element is the public health elements is how to introduce topic to people that they may not be interested to listen. It's easier to start from physical health before you talk mental health. So we start to talk about how about diabetics. And then I still remember, on one hand, when I visit the American Diabetic Associations, asked for relevant printed information in different languages. No Chinese information, no other languages. So that pumped to, hey, we need to do something. And I still remember when we conduct our first diabetic class, education class, we need to contract a nurse from the healthcare system because not everyone can talk about diabetic intervention until you are qualified. So we contract and then pair up with bilingual persons and then introduce. And then the groups like 30 people join. They said, well, we don't have problem. We don't eat candy like American. We don't drink soft drink that often. I only sip a few. So that means no problem. And then the educator asked, like, what's your usual diet? Well, regular Asian diets, I eat 3 bowls of rice each time, and then vegetables. So, and I do exercise. And then people say, 3 bowls of rice. That start the conversations. And so with that said, I think I lay out hopefully a visual graph that maybe later on you can take a look. That is a cone-shaped model with engagement first from people where are they coming here as immigrants, and then engage with our community program, and then introduce the public health elements. So they learn about how to take care of their blood pressure, diabetics, or like sleepiness, to something like mental health. What is mental health? And then mental illness. So the bottom part is the mental health. So with this 3 level, that I see like, yes, the targeted clinical intervention is behavioral health, but we need to find way to address the now is health related social needs. And we need to talk about the early interventions, or even people don't have insurance. So with that said, we have developed 4 levels of services. For the community engagement is community services, partnership with county, get the funding to have what we call the focal points intervention that people come. And then we also work with state to be one of the few state certified, qualified health insurance assister. So we promote, we educate, we help people to apply for government health insurance. And at the same time, we understand that not only they need to engage, they need to be also empower the understanding, the knowledge to have the understanding. So we develop program to help them to navigate the system. We currently have a partnership with Care Oregon, actually help people to navigate the system. Even though people have the health insurance, they may not use it. So we have the system navigation program. And we have the public health programming that, especially for immigrants, they may not know that while fishing is like a hobby, good thing, but Willamette River may not be a good place. So we need to let them know that, like, how to avoid anything that may harm their family, like lead paint in their home. So that is the public health programming. And then our very unique state certified outpatient behavioral health program. And again, I emphasize that we address the patient, not the symptom management, but the whole person, from engaging them, from understanding their family situation, from other social services. So that lay out like we have the community engagement services, we have the health insurance and system navigation services, we have the public health programming for information and help them, and then the clinical program. The clinical program, not only we secure the funding with like tremendous effort to advocate for our clients, but at the same time allow us flexible funding to engage, to allow us to provide free early engagement interventions. People may not tell you they have problem. Like Dr. Sito mentioned, a patient said, I have a friend have that symptom. How can I help that person to eventually, because of the level of trust, they disclose that that person is me. So that helped the clinical program. Not only with that, we also contracted with state and county and other partners for early interventions, for suicidal preventions. New generation bring the children and family together. Dream tracer coming to this country. Parents work hard but have high expectation on the children. So that means academics, they want them to be the best. Career, they want to be all doctor, all lawyer, all engineer. But not everyone can accomplish this. So that's why the movie Tiger Mom becomes so popular. But like with that said, our program also very effective because all my clinicians are bilingual or multilingual, or our psychiatrists are multilingual, and then we are all Asian backgrounds. So it's easier to communicate two-way with the parents, understand their situation, but respect the children's school counselor refer them to us. We talk to the children, but honor their privacy, not to being overloaded by the parent. That is very successful to prevent Asian children to disclose that they have suicidal ideation. They feel they are under tremendous stress. They're being bullied from the classmate. They don't know how to voice out. So that is one very unique program that the behavioral health programs doing. Other than that, gambling. No, we only have social gathering. We pay marchok. We pay a lot of activity, social habit, but like with the trust also, and also the clinical training for gambling treatments and preventions. We work with our clients' family first, because usually the principal clients may deny for services, but family members say that I have an issue. How can I do something? So we start from family, and then eventually help the family to work with the principal client. So that's the clinical program. I think I name a few outreach engagement, specifically youth-focused suicidal prevention to gambling, stigma, and then chronic disease behavioral program. If you see this is the cone. Before we have those elements, it becomes the only way, the bottom of the cone. They go through hospitalization, wrong entry to other system, finally come. Now, they can come, everyone's in white. They have issue, no issue, here issue from family, all welcome. I can tell like when I start working here as a clinician, our entire program is less than 60 patients. And now we have over 20,000 members. So the population growth and the agency grow together with the communities, expanding program, expanding services. So currently according to the latest census, there's over 200,000 Asians immigrants call Oregon as their home. And we have about 10% of those people are our member. So 10%, if you add like a member of 2, that become more than 20,000. If a member of 3, the number, so we are not saying that while we cover everything, but I think we are very focused on health and service. And people ask like, why your agency is not just Asian Health Center? Is that, well, we consider service is step 1, like health-related social need. Through services, you engage those people. And then some people feel comfortable to the mental health program. Some people may still observe. But when they become more stable, the beauty is that our center is open to all. Even like you are totally recovered, don't have like a serious symptom, you are still engaged coming here. Some people may go to work part-time, but afternoons, like this afternoon, actually have the Cantonese opera singing, start from 1 to 3. People will come and join some activities. So that is make our agency, a lot of people consider it's like a home. It's away from home that they can engage, make friendships, address some of the tasks, what we call case management, that because the cultural barrier, that the language barrier, that they need help. So that's how this agency grow from small space for 600 square footage, and then move to Powell Boulevard for more space, and then on 2016, dream about having our own space, and with the support from all parties and also the leadership from my board chair, we complete the building. I think is amazing. We have our ribbon cutting, a very unique number, 2018, August 8. Why so many 8? In Chinese, when you pronounce 8, that means riches. So I say 2018, August 8. So everything seems like so unique. And the building, if you, after I share with you about our model, engagements, public health interventions, and clinic, the architect used the same idea to build this building. We are now on the 3rd floor. That is the open space. That can, the function hall, just the function hall is 6,000 square footage. So with the space, we can engage more people. And the 2nd floor is where meeting, where you can see our staff working there, and also there are training rooms that we can provide training. And the main floor, when you walk into this center, you don't feel that you are entering an outpatient mental health clinic. You see the calmness sand gardens, and you can see people greet you, and then people can walk up the stairway. One uniqueness about our stairway, if I have chance to like show you, is that the handrail is double. One is the standard, and also a wooden one lower, because a lot of our clients, especially the senior, they would like to do exercise, but they don't want to walk outside, especially during the pandemic time. They don't want to target it alone walking in the neighborhood. They don't want to go to the gym to do exercise, but that becomes the exercise stair. So people come, they walk up, down, and so that's why the stairway, even the handrails, we have the steel handrail, we have the wooden handrail, and then they can hold and then walk. So that makes this building is like actualize our visions, engagements, public health interventions and clinic interventions. So there's a cone shape. And co-located next door is a federally qualified health clinic. So primary physical health, the behavioral health, the public health, and social needs all one place. So that makes this building very unique. And this room is also very unique. We've been dreaming to have a cancer support program. When we first start working with funding from the Susan G. Komen Foundation, and then reaching out to the Asian ladies, talk about mammogram, the significance of mammogram. I think people may already know traditional belief, and we do researches. If you don't see doctor, you don't have problem. If you don't do mammogram, you don't have breast cancer. That become the norm that we need to shake. And then eventually we help people out, annual checkup, early intervention, preventions. But what about when people being diagnosed with cancer? They may receive very good clinical interventions, support within the healthcare system, but in the community. So that is something that we've been dreaming, and then when we know that there will be a place, we will build our center. We designated this room to be the Asian Cancer and Resource Center, which is next door to our activity room. So that means patients or caregiver can come together. Patient can take a rest here and then enjoy some of the readings or informations, while caregiver also have a break time to relax, sing Chinese, Cantonese opera, and then go. So that is very unique that make this program. When we start, we thought, well, where to get funding? We partner with Night Cancer Institute, do a survey, a national survey about what is available nationally, and then eventually form these projects. And the challenge is we kick off these projects in 2019, September, and 9 is last forever in Chinese. So 2019, September, the reality is that COVID started. And then by 2020, shelter in place. We worry, even our partners, our grand partners like Murdoch Foundation, Oregon Community Foundation, Myers Foundation, say, do you need to readjust your implementation plan due to the situation? We say, well, we'll try, because like this building, we already have the equipment updated. We can do telehealth, can work with the clients, one number, and then link with my team. Just the first year, 160 patients and caregivers enrolled in the program. Even we cannot open the space. And then with another grant from the Night Cancer Institute, we piloted the Asian diet and cancer. And then patients are invited, if they feel comfortable, to come in 2021 with their family. And then you see that we have a demonstration kitchen. We can demonstrate how to cook, prepare some meals that for prevention, during treatments and aftercare, nutrition, food. And then we worry that like enclosed in that kitchen may not be good. And we have actually an open terrace towards the end of this hall. We open up the balcony, and then we set tables. About 20 family join, and then they learn how to cook together. And I was around, and then I was impressed by my family come together with the patient. And then I noticed that two ladies cooking together with another lady. The older ladies, I think she's around 70 or 80. The two ladies should be around 50 or plus. And then when they cook together, and then I check with them, hey, what's your combination? They said, the mother said, oh, wow, they are my daughter. And then I haven't thought like deeply. I said, wow, it's beautiful, because like seeing mother and daughter cooking together. And then I asked, when's your last time the daughter and mother cooking together? Oh, people, tears come up. We miss all those chances. We miss the chance to care for my mother. And now, the mother is like receiving cancer treatment. So, very impressed like about the needs of like having a program that address not only the food, is behind the food, the family connections. And last year, I was invited by another group, a national effort, to join a national conference. Is Together Supportive Cancer Care. Is talking about outside the hospital system, how to provide a continuum of cancer care for patients and caregivers so that they can fight a good battle and support each other, even like the situation is not in a favorite situation. So that is one part of this room. Yeah. I think for us, this agency growth is not just like our good efforts or our wisdom, our ability. We consider it as a collective work. It's a collective effort advocating for the minority that we serve. And there are more than one minority group that are having some similar visions. So with that said, I start to coalesce and facilitate meeting of other culturally specific providers, and then started the Alliance of culturally and linguistically providers networks. So the alliance worked together for over 20 years. And during the pandemic times, the lessons we all learned is that we need to collaborate. We cannot rely on our own effort to make something happen. So with that said, I learned that through the pandemic time that collaborations is the essence of all efforts to address the common good. So we kick off the collaborations theme, and then this year we continue. The theme is empowering through unity. It's not just like ourselves, but we work with our clients. Actually, I show you some artworks contributed by clients. I tell you some story. It's life story. We empowering each other.